Obesity-related cancer deaths have surged dramatically in the United States, tripling over the past 2 decades. This trend marks a disturbing shift in the landscape of cancer mortality, where excess body weight has emerged as a potent and independent risk factor. Once primarily associated with cardiovascular diseases and diabetes, obesity is now increasingly recognized as a driver of malignancy. The rise in obesity-linked cancer deaths reflects not only changes in public health, but also deeper issues in access to care, dietary quality, and structural inequities. The data show that women are especially vulnerable. Hormonal factors likely contribute, particularly as excess fat tissue influences estrogen levels, which are implicated in breast and endometrial cancers. Older adults also face significantly higher risks, partly because cancer is already more common with age, and the cumulative effects of long-term obesity intensify the likelihood of developing aggressive or treatment-resistant tumors. The intersection of age and obesity often means more comorbidities, more complex treatments, and lower survival rates. Equally concerning is the growing burden in rural areas. Residents of rural communities tend to have higher obesity rates due to a combination of limited access to fresh foods, fewer safe opportunities for physical activity, and underfunded healthcare systems. They are also less likely to undergo routine cancer screenings, which means cancers are often diagnosed later and at more advanced stages. Transportation barriers, medical provider shortages, and lower socioeconomic status amplify the risks further. These structural gaps are not just unfortunate, they're deadly. Even more troubling is that many of the cancers most associated with obesity, such as colorectal, pancreatic, liver, and kidney cancer, are among the deadliest. Prevention strategies that target obesity may not immediately translate into fewer cancer deaths because the disease can take years to develop and current cases reflect past decades of exposure. Furthermore, there is still insufficient awareness among the public and even some healthcare providers about the link between obesity and cancer. Many people do not recognize weight as a modifiable risk factor for cancer, focusing instead on smoking or genetic predisposition. Efforts to reverse this trend face steep challenges. Obesity is driven by complex, interwoven social, economic, and behavioral factors. Solutions require more than just personal willpower. They demand systemic change in food policy, urban planning, education, and healthcare delivery. Without large-scale interventions, these deaths will likely continue to rise. Worse, they will likely continue to hit the most vulnerable the hardest: women, the elderly, the poor, and those outside major urban centers. The U.S. is facing a preventable public health crisis, and failing to act now will cost even more lives in the future.